The history of using gastric balloons for weight loss traces back to the 1950s, with one of the earliest approved models called the Guerin-Edwards bubble. It was a cylindrical balloon filled with liquid that took up space in the stomach, prompting a reduction in food intake and subsequently weight loss. This simple concept has since been copied by numerous companies that have introduced various versions of the gastric balloon. Although they all fall under the umbrella of, quote, intragastric balloons, there are some interesting differences that set them apart. Let's review 6 different types of gastric balloons. The Orbera balloon is probably the most commonly used gastric balloon in North America. It's actually the first gastric balloon to be approved in the US. As such, they have been used the longest and have the most research backing their use. Nearly all the patients I support for weight loss have this particular balloon, making it the one I'm most accustomed to. In its most basic form, it's a single silicone balloon. The process involves inserting the deflated balloon into your mouth, into the stomach, and filling it up with around 700 milliliters of liquid. That's about the size of a grapefruit. Removal follows a similar route, draining the liquid and then pulling it out through the mouth. Both procedures require sedation. Typically, the Orbera balloon stays in your stomach for 6 months, but there's a variation, the Orbera 365, that can stay put for up to a year. One big plus with Orbera is its widespread use. Given its long history of use, many doctors are experienced with the insertion process, reducing the risk of serious mishaps or nasty side effects compared to less common options. Plus, it's proven to be quite effective, as numerous studies over its extensive history has shown. The ReShape Duo balloons are 2 gastric balloons linked together. They slide the deflated setup into your stomach through your mouth and fill both balloons with liquid. The maximum inflation is 450 milliliters for each of the balloons, totaling 900 milliliters. You'll be sedated for both insertion and removal, and it's designed to stay in your stomach for around 6 months. The dual balloon design aims to improve the fit of the stomach, supposedly enhancing appetite suppression. However, there's no evidence suggesting that it's more effective for weight loss than the Orbera. While the double balloon setup lowers the risk of one balloon bursting and causing a blockage in the intestines, the trade-off is a bulkier balloon system and subsequently more complex insertion process compared to the simpler Orbera balloon. Though FDA approved, the ReShape Duo isn't as widely used, and it's actually been phased out recently, making it potentially harder to come by these days. The SPATS 3 balloon is able to adjust its volume while in the stomach. The balloon is attached to a short tube which is left in the stomach. This nifty setup allows the surgeon to go back in whenever needed, using the tube to tweak the balloon's volume. Liquid can be added or removed based on how well you're handling it and your weight loss journey. It maxes out at 900 milliliters for those who can handle it. You'll also need to be sedated for both insertion and removal procedures, as well as any adjustment procedures. It can stay in the stomach for up to 12 months. However, there's a bit of a catch. The balloon system is a bit heftier and more complex, lacking the smooth, round simplicity of the Orbera. Also, it's a relatively recent FDA approval, so not many doctors have honed their skills with this system. As a result, the insertion, removal, and adjustment procedures tend to take a bit longer and is a tad more difficult to do. The Heliosphere balloon, also known as the Heliosphere bag, is a gastric balloon that's filled with gas. The system can hold up to 1 liter of gas. However, like other gas-filled balloons, the actual volume of the balloon is less because air compresses more than liquid. So 1 liter of air in the Heliosphere bag compresses to around 700 milliliters in the stomach. Other benefits of using gas? Well, supposedly it's easier on the stomach, aiming to minimize post-insertion discomfort like pain, nausea, and vomiting. That's because it's lighter and shouldn't irritate and bang around the stomach as much. However, inflating an air-filled balloon in the stomach is trickier compared to a liquid-filled balloon, and many surgeons find that it's harder to manipulate when positioning it. So the insertion process tends to stretch out longer. Plus, air-filled balloons are more prone to leakage, increasing the risk of deflation and other related issues. Another problem is that having gas in the balloon means you can't engage in activities like scuba diving, high-altitude mountain climbing, or travel in unpressurized airplane cabins, as it could blow up your balloon if you're not careful. Due to these complexities, gastric balloons filled with air are not commonly used, and the Heliosphere balloon is not even FDA approved for use. The Obalon balloon is another gas-filled balloon which is delivered in a unique way. It can be swallowed as a pill and doesn't require sedation to insert it. The pill is connected to a thin tube and filled with gas once in the stomach. However, to remove the balloon, the surgeon needs to fish it back out, so sedation is still required for removal. These balloons are smaller, holding only 250 milliliters of gas each, but you can use up to 3 at a time for added volume. All the balloons are removed by 6 months after the first balloon's insertion. With a smaller starting balloon and no sedation required during insertion, it's generally better tolerated up front, and more balloons can be added later on as the patient progresses in their weight loss. However, like other gas-filled balloons, it's a bit more compressible, making it less effective than the liquid-filled balloons when it comes to appetite suppression and weight loss. The Obalon balloon is FDA approved, although not commonly used. The Allurion balloon takes the convenience of the Obalon balloon up a notch, but it's not just a pill you swallow, but also designed to break down over 4 months and deflate on its own. Once deflated, the remaining thin material naturally travels through your digestive system and gets passed out the usual way. The biggest benefit of this all is the convenience factor. No need for sedation during both insertion or removal. Just swallow the pill, let it do its thing for 4 months, and out it goes. It's the easiest and simplest balloon for patients, cutting down on medical personnel, side effects, and often cost. Now, here's the catch. Since the balloon needs to exit on its own, it's a bit smaller and contains about 550 milliliters of liquid. Plus, it's made of a thinner material, which may not be as potent as the sturdier gastric balloons that require sedated removal. And because the passing process isn't foolproof, there have been rare instances of the balloon getting stuck and causing blockages in the intestines, requiring surgical intervention. Allurion is approved in Canada, but is still awaiting approval in the US. It's actually gained a bit of popularity recently for its convenient, user-friendly approach. So which is most effective for weight loss? There isn't a straightforward answer, mainly because there aren't direct comparisons between them. Using the different balloon sizes as a yardstick isn't very helpful either, as the actual final volume of the balloon depends on the patient's stomach size and the surgeon's comfort level during installation. From observing patient experiences and looking into the research, it seems that thinner-walled balloons like the Allurion may not be as effective as their thicker-walled counterparts such as Orbera, ReShape Duo, or Spats 3. Also, I haven't seen any convincing evidence to suggest that there is much of a difference between any of the thick-walled balloons. Thinner-walled balloons tend to lose their shape easily, get manipulated and compressed by the stomach, and deflate quicker over time. Gas-filled balloons like Heliosphere or Obalon might also be less effective based on the research. All that being said, Orbera is the most extensively studied balloon, typically delivering a weight loss ranging from around 5 to 15% body weight while in use. Despite some marketing claims of greater weight loss with some of the newer balloons, the studies supporting such assertions are often small, so I'm not convinced, and I'd expect a pretty similar real-world efficacy with those other balloons as well. Hi, I'm Dr. Brian Young. What are some of your experiences with gastric balloons? Let me know in the comments down below. Subscribe and hit the notification bell to stay up to date. And if you found this informative, please leave me a like and share this video with someone you know can use the info.